question about the safety of flying on major airplanes. What do you say about that?
Yeah, it's a situation where it's required that you wear your mask. I would probably wear a face shield as well. That gives you the highest form of protection. I give you that N95 with a face shield. It's the highest form of protection that we can get, as without going to things like a PAPR.
Yeah.
Or
a face shield ain't sexy though, man.
No, it's not sexy. But you know, staying alive is sexy.
Yes, sir. hey, dead ain't sexy, right?
That's right. Yeah, I mean, I used to go to Asia 10 years ago. I used to go to Asia. I used to go to Asia a lot, and I see the people there wearing masks, and I saw them wearing face shields, walking around on the street, and I'm like, man, why are these people wearing a face mask and shit? What's wrong? What's wrong with them? Mm-hmm. They had experienced H1N1 in a way that we had never experienced the flu, and they had decided that the swine flu, to put a face mask and a shield on was more important than experiencing the down road complications of the H1N1 infection. It was a different kind of thinking, Dr. Thomas. It's a different kind of thinking when you decide, I want to wear a mask because I don't want to experience this virus. Mm-hmm. My friend Jeff Walker, who might be listening in this conversation, he had this. He sent me this was really, really good. He said, you drive down the road and you see this sign called "Ticket or Click It."
Yeah, I saw that.
Right, but the other one was I think it was mask it or casket.
That's right. That's right. That's right.
I like
that.
New
campaign. That's the new campaign that we should have. Yeah.
That's right.
So Robin said that Jeff is on Facebook and he's doing a watch party. So he's got about 1 million people on his. Jeff. He got about 1 million people watching with him. So outstanding.
Yeah, Jeff Walker is a real trooper. Jeff Walker is a lover of Oakwood and a lover of truth. So good man.
Yeah, and he's also in the class of '86. Give him the '86 love, right? All right, so we coming to an end, folks. So go ahead and list your questions as we come to a close. Now, so Dr. Eric Moore is saying, speak to the testing for polymorphisms. Is that something that can determine the infection risk? Eric Moore.
Yes, so there's some quick ways and there's some genetic ways to do the testing. And there's the concept being you may be able to look at the renin levels to determine whether a person may have the polymorphism for processing the ACE. The ACE, we know what the ACE enzyme does in regards to processing renin into angiotensin 1. So that means in a way real easy that you can go from 1 to 2, but there's something that helps you go from 1 to 2. If it's blocked, then you have a whole lot of 1 left around because you were never able to convert it into 2. And so we're talking about going from renin to going from 1 to 2. The ACE enzyme will help. Will if you have a problem there, you'll see 1 levels go up. And so we think maybe that you'll have higher renin levels because of the ACE2 polymorphism. If it slower processes it, if it faster processes it, you're going to have a lower levels of the renin. But you could also do a genetics test, and you could do a polymorphism evaluation for polymorphism by genomics analysis, and that will give you a more definitive answer. And those are available. People do them. They aren't readily available, but maybe over time we can get those readily available as well. Now, I think that's probably my best explanation for the good Dr. Eric Moore.
Okay. Excellent. Excellent. All right. If you got a question, please put it in there. Put it in there. Another question, Robin Langley. What's the latest in terms of finding a vaccine in the medical way to contain the virus? Incidentally, when we were on last time, 15, 16 weeks ago, you said, look out, because you were working on something and others were working on something. And so talk to us about what you have done to the extent that you can, and what should we be looking for in terms of interventions and therapies, viruses, and the like.
Yeah, so we found, my group has found that the you remember I talked to you about the spike protein attacks the cell, and it attacks it at a specific place. That place is an enzyme called ACE2. And so we have found that actually if you could increase the levels of that ACE2, you don't get more infection, you actually get protection. And so drugs that can upregulate that enzyme will be protective. And let me break it down to the real level, to the understanding real level. So people who are taking who are hypertensive and are taking angiotensin receptor blockers, that would be telmisartan, losartan, irbesartan, anything that says sartan. Those drugs upregulate that protein, and we have found through some studies, clinical studies, as well as research studies, that those patients have a protection from the virus if you can get their ACE2, ACE number 2, you can get their ACE2 levels up. Another drug that does it is the cholesterol medicines. So HMG-CoA reductase, those are statins. So if you have high cholesterol and you're on a statin, like atorvastatin, like rosuvastatin, that would be Crestor, that would be Lipitor. If you're on those kinds of drugs, they raise the level of this ACE2 protein. This ACE2 protein is anti-inflammatory, it's cytoprotective, it's antifibrotic, it stops the cytokine storm if you can upregulate this protein. And so the point is that you will have, if we take these drugs already, even if you got the infection, we believe that you would just have 9 to 10 days of feeling the cruds, but it won't progress into this multi-organ, multi-disease type of therapy. And so we're doing clinical trial, getting clinical trials together to look at how we can boost. And let me make it real. How we can turn the sprinkler system back on, because this protein is what the sprinkler system is. It's turned off. How we can turn the sprinkler system back on, which is ACE2, ACE2. If we can turn it back on, we can keep you from getting this cytokine storm. And that's what we're really working on. We presented some commentary to ASCO. We got some clinical trials written for people. And Dr. Thomas, I'm gonna get real with you. You get a cough, you get fever, and then a headache, and you go to the emergency room. What are they gonna give you? They're gonna give you some Tylenol, and if you don't have pneumonia, they're gonna send you back home. So we're saying, wait. Let's put patients that come in with those symptoms, let's put them on a 21-day trial of telmisartan and rosuvastatin and send them back and keep them protected so that they don't get the cytokine storm. They just have a viral sequelae. That's called boosting the host defense to the virus, not attacking the virus, but turning the sprinkler system back on so that you can fight the virus and you don't allow the virus to become uncontained by starting fires that you can't put out. So that's where we are. I hope I broke that down in a reasonable level that people would understand.
Excellent. No, that is fantastic. Let's see. Is a person who is T1D more prone to COVID? I think that's what someone is asking. A person who is T1D, are they more prone to COVID? Do you understand? I'm not sure what T1D is.
I don't understand with that question, but
Okay. Yeah.
I could provide some commentary at a later time.
Okay. All right. Very well. All right. So then wrap us up.
Type 1 diabetes. That's
Oh,
what
okay. Type 1 diabetes.
T1D.
Okay.
Yes, I understand that question.
Okay.
Yes, yes. So there are some comorbidities, and there's some reasons why patients who have, if you're hypertensive, you may be protected because you're on one of those medicines. If you have high cholesterol, you may be protected from one of those from by taking those medicines. Diabetes, on the other hand, you may be more susceptible because your immune system may be compromised already. Not just the cell sprinkler system turned off, but outside the cell, the immune system may have may be compromised because of your diabetic state. And so, yes, you are prone. You may be prone to have a much more heightened response based on having type 1 diabetes, type 2 diabetes, obesity, some of those things, because they affect your ability to respond, your inflammatory response. And so, yes, the answer is yes there. And I'm sorry I didn't get when you said the T1D, I didn't know what the acronym meant. Thank you.
Oh, yes, yes. Yeah, folks, put up acronyms sometimes. They the only ones who know what they mean. All right. What a blessing this has been. Thank you, Dr. Thomas. Thank you, Dr. Brown, from our good friend, Dr. Eric Moore. All right. Well, any final words or final admonishments that you'd like to give us in conclusion as we transition out, Dr. Brown?
Well, Dr. Thomas, I'm gonna be honest with you. I'm not being political on this day, and I'm not being political on this show. But I want to say this issue that we have a problem because we lack a national policy for how we are going to deal with this virus. We have one state doing this, another state doing this. Within one state, several counties have decided that they won't do what the state requires, and they are doing more or less. So in times where they do more, their counties are much more protected. In counties where they do less, they're less protected. So we need a national policy that is stringent about how we deal with this virus. It's just we lack a national policy, and I'm saying that in a non political way, but a medical with a medical perspective. And then second, because we don't have a vaccine and we don't have a therapy that will either kill the virus or boost your immune system to deal with this virus, then we have to implement good public health perspectives. Like one, please mask up. Number two, please wash your hands constantly. And number three, please stay 6 feet or more away from others while wearing your mask and provide the right social distancing. So the next thing that we have to do is we have to recognize the dangers, and we have to address the dangers. One is public bathrooms. We hadn't talked about that before. I want to caution your listeners, and I want to caution the people that are watching your Facebook to please avoid public bathrooms. We're going to deal with these public bathroom issues when churches open, when schools open. They're going to be a source of infection. Please stay away from them. We're saying this now early. You heard it first on the Facebook page of Dr. Thomas and the Rainbow Community Church media. I want to say another thing. Do not, if you're sick, This is simple. Stay home. If you believe you have been in contact with someone who had the virus, go get tested. In fact, I got tested this week, Dr. Thomas. A friend of mine had a exposure in his office, and we spent 3 days together fishing out in the ocean this week. I took a little time to do a little fishing.
Yes, sir.
And so, but there was exposure, but it turns out we went and got a 24-hour test. There's a 24-hour test you get back in the data back in 24 hours, and we were negative. And but just being careful, because you don't want to spread it to your home, to your family, to your kids, to your loved ones. So if you are feeling sick, get tested. If you're not feeling sick and you got exposed, get tested. Testing is important. You just had to have a doctor's note. You call your doctor, you tell them you think you may have come in contact with someone who may have been tested positive. They'll give you a note, you go get your test, and you find out the results so you can be prepared as to what to do. The last thing is I want to say, do not, please, and I'm begging. Right now, Milton Brown is begging. Don't send your kids into a certain infection, into a place that will lead them to a potentially long-term disability or death. Sending your kids to schools at this time is a problem. I'm not less clear on this. 3 months ago, I was unclear because we hadn't dealt with this enough. But now I see the trends. I see what's happening with when they open up the daycare centers. These are kids that are 1 to 6. How the virus exploded in Texas, in that group, in that patient group. Don't send your kids into this virus. Stay away from this virus. We're going to learn how to coexist. Dr. Thomas, I'm going to have to come back, and we're going to have some innovations on how we coexist with this virus that we're going to have to learn, because I'm about to say something here that I want to be clear on. We're not getting rid of COVID-19 for another couple years. It's just not going away.
Wow.
Okay, it's not going to go away for at least a couple of years. And so I got to say this one thing, and it's something that I didn't tell you. There are 2 things that I'm worried about. Does anybody want to know what they are? Like, what do I see? What am I seeing down in the future? Like several months. Yeah. What are we facing?
Tell us, Prophet Brown. Tell us, Prophet Brown.
See, when I was on your show 15 weeks ago, I gave you a visual of what we're facing, and guess what? I have to say that I was right.
Yeah. That's true.
Well, this is what I'm watching out for my own self and my family and the people that I love. I'm telling you something that's going to happen 2 to 3 months down the road. The Chinese have warned us that there's an unknown pneumonia that they've seen. Over 2,000 people have been infected and many have died. And they told us that 1,772 people have been killed by unknown pneumonia. We have to be careful because this could present a problem for us when we open up. The second thing, and this was reported to the Proceedings of the National Academy. I'm a member of the National Academy. This is the Proceedings of the National Academy, and this was a recent publication. It's called another virus. It's called a G4 Eurasian virus. It's an H1N1 virus. It's been spreading in pigs in China since 2016, and it's become the predominant type of virus. Now, thank goodness, G4 viruses don't readily infect humans. But watch this. 10% of the swine workers that were taking blood samples from in China had evidence that they had G4 infections. So G4 swine-like flu can produce a pandemic potential. So we got two types of viruses that we know are out there now that we have to be very diligent and vigilant in watching. That's what we're facing in 3 to 4 months. And so we have the COVID-19 that's going to continue for several years, 18 months to two years. And we have to watch for the new pandemic viruses that are definitely there now, and that are sitting at our edge door of infection.